This is an X-ray machine. I will let you know about different equipments of X-ray machine. This is an X-ray tube, X-ray table. This is the X-ray cassette. In elbow joint, there are having two sizes in the cassette, that is 8 into 10 and 10 into 12 inches in size. But now we are using in 8 into 10 inches in size. This is front side and this is the back side. The front side is made up of carbon and the back side is made up of lead. And this is the grid, which is no need to using in elbow joint X-ray because of low kVp and low MAS. This is the sustain. Now let's get started with our presentation. First of all, we have to open the X-ray machine, and this is the process how to switch on the machine. In conventional radiography, there are two types of process, manual and automatic. Now we are going to do in manual processing. All set of kVp and MAS. Before doing any kind of X-ray, technicians should be asked to the patient about their problem and say about some important role in X-ray during that time of procedure. That is, remove the radio-opaque materials from that particular area and wearing the hospital gown, etc. The elbow is a hinge joint made up of three bones, the humerus, ulna and radius. The ends of the bones are covered with cartilage. In elbow joint, there are two projections, that is AP and lateral. In AP projection, the position of patient and cassette are: the patient is seated alongside the table with the affected side nearest to the table. The arm is then extended fully such that the posterior aspect of the entire limb is in contact with the cassette and the palm of the hand is facing upwards, that means facing towards the X-ray tube. The unexposed half of the cassette is positioned under the elbow joint with its short axis parallel to the forearm. The main indications are trauma, bony tenderness, arthritis, infections, suspected fractures, and contraindications are open fracture and pregnancy. The vertical central ray is centering place to the point midway between medial and lateral epicondyle of the humerus. Now we are going to do expose. And this is the image of an X-ray film of the elbow joint. The radiographic anatomy of an elbow joint are: the central ray must pass through the joint space in 90 degrees to the humerus to provide a satisfactory view of the joint space, and the image should demonstrate the distal third of the humerus and the proximal third of the radius and ulna. In lateral projection, position of patient and cassettes are: from an AP projection, the elbow is flexed at 90 degrees and the palm of the hand is internally rotated so that it is at 90 degrees to the tabletop. The shoulder is lowered so that it is at the same height as the elbow and wrist, such that the medial aspect of the entire arm is in contact with the tabletop. The half of the cassette being used is placed under the patient's elbow with its center to the elbow joint and its short axis parallel to the forearm. The vertical central ray is centered over the lateral epicondyle of the humerus. This is the image of an X-ray film of the elbow joint in lateral view. Radiographic anatomy. The central ray must pass through the joint space at 90 degrees to the humerus, that is, the epicondyles should be superimposed, and the image should demonstrate the distal third of humerus and the proximal third of the radius and ulna. After done, we have to do switch off the machine, and this is the procedure how to do switch off the machine.
This is all about